The U.S. saw a record number of new COVID-19 infections Monday as the Omicron variant continues to surge. The spike in cases comes as health experts say most people will contract the virus. A hearing with top health officials on Capitol Hill Tuesday included intense criticism over the scarcity of COVID tests and the mixed messaging on how to react to a positive result. Meanwhile, U.S. schools are struggling to remain open and productive as the Biden administration vows to send millions of test kits to educational facilities. For more, let's bring in Dr. Amesh Adalja. He's an infectious disease expert and senior scholar at the Johns Hopkins University Bloomberg School of Public Health. Dr. Adalja, thanks very much for being with us. CDC Director Dr. Walensky says that Omicron cases are expected to surge in the coming weeks. What do we know about if and when this latest Omicron surge may be peaking?
What we know is that in places like South Africa, where the Omicron surge first occurred, this went through a couple of week cycle and then cases collapsed. And there is evidence in parts of the United States, for example, in New York or in Boston, where they look at wastewater sampling, that there is some decrease in the number of cases there or the number of positive samples in wastewater. So we may be peaking at certain parts of the country. Not every place in this country is on the same timeline, but I think over this next month, over January, we will likely see peaking. The key is to get these hospitals through this period of stress.
Well, what can you tell us about the CDC potentially changing its guidelines on the best types of masks to wear?
Because Omicron is more contagious, because it's able to infect vaccinated people, this is something where you have a really unforgiving variant of the virus. So it's important, if you're trying to avoid infection, especially if you're not vaccinated, that you wear a mask that's effective. So some of these do-it-yourself cloth masks may not actually be up to the task. But the most important thing to remember is the best mask is a mask you actually wear. So if people get N95s or KN95s and they can't wear them because they're uncomfortable or they don't know how to wear them properly, they're not going to be very effective. So the key message is the mask that you wear religiously, that's the one that's actually going to be the most effective.
Well, the Biden administration will soon begin shipping 5 million COVID rapid tests to schools each month. How important is the role of testing to keeping schools open?
We want schools to be resilient to COVID-19. We want in-person learning to be prioritized and schools to never have to go on distance learning. One way to do that is to implement certain policies like the CDC's Test to Stay. And in order to do that, we need to make sure that those schools have access to tests so that they can use them appropriately, so they can keep kids in school. So this is going to be really important as we try to traverse this pandemic and keep kids learning. We need to make sure that that schools have the tools to be able to implement all those best practices we know that make schools safe.
Well, the White House COVID-19 response team will soon appoint Dr. Tom Inglesby as the head of COVID testing. In many parts of Europe, testing is widely available at little or no charge. What would you like to see, Doctor, from the Biden administration in terms of testing?
So I'm a bit biased because Dr. Inglesby has been my mentor since 2008. He's probably the reason why I'm sitting here talking to you on television, because he trained me. And he's the director of the Center for Health Security, where I've worked since 2008. So I'm glad to see the Biden administration putting an infectious disease doctor in the lead here. I think it's going to be really important that we try and develop a sustainable approach to testing where we don't have supply shocks, where tests become cheaper and more ubiquitous. I think what I want ideally is the Biden administration to listen to people like Dr. Inglesby and develop a program that's going to build on what we've done so far with COVID-19, extend it to influenza and other respiratory viruses. But it really has to be the case that testing needs to be cheaper out of pocket. It has to be ubiquitous. We're going to need it for drugs like Paxlovid, the antiviral that's approved by Pfizer. So this is not a short-term thing. We need this to be sustained as we move through this pandemic.
Well, former President Trump issued a public rebuke to any politicians being less than forthright over their vaccination status.
I've taken it. I've had the booster. Many politicians, I watched a couple of politicians be interviewed, and one of the questions was, did you get the booster? Because they had the vaccine. And they're answering it like, in other words, the answer is yes, but they don't want to say it. Because they're gutless. You got to say it. Whether you had it or not, say it. Right. But the fact is that I think the vaccine has saved tens of millions of people throughout the world.
Mr. Trump himself did confirm his vaccination status when asked. We had seen, though, before, he often acted against the advice of his medical experts, for instance, holding rallies with largely maskless attendees. I'm wondering, Doctor, in your experience, are political leaders important messengers for public health?
I do think that based on the culture we live in, that political leaders do have a lot of influence. We've seen this throughout the pandemic, that politics and politicians do sort of dictate the way many of their supporters will act. And I think it's important that President Trump, who's the signature achievement of his administration was Operation Warp Speed, and these vaccines should be out there talking about how beneficial they are. And I think that when politicians are pandering to anti-vaccine groups by hiding their own vaccination status, I think that's really deplorable conduct. I think people should be proud they got this vaccine. That tells people that they understand science, that they think that science is the solution to this pandemic, and to really continue to engage with the anti-vaccine movement, who are literally killing people by dissuading people from getting what is a great piece of technology, I think is mind-boggling. So I think that politicians should be very vocal about their vaccination status, at least so we can know who's vaccinated and who is not. But I think that President Trump deserves credit for promoting the vaccine, that his administration did help develop programs to get into the arms of people in record time.
All right, Dr. Amesh Adalja, thanks very much for sharing your expertise and perspective with us.
Thanks.